Welcome to the Medtronic Learning Series. This is the lumbar disc herniation module. In this module, you will learn about how the lumbar spine undergoes changes during the normal process of tissue aging. These changes are not always related to your age in years. This process can allow for the nucleus of the intervertebral disc to herniate, resulting in sciatica. Disc degeneration affects the lower lumbar discs most often. Most disc degeneration is part of the normal aging process, and in most people, it is not painful. Just as with graying hair, balding, wrinkles, and other physical signs of aging, the age at which degeneration starts, how quickly it progresses, and its severity differs among individuals. In rare instances, the degeneration process can begin as early as the teens or young adulthood. A combination of factors contribute to degeneration, including genetics and environmental influences such as smoking. Degeneration of the lumbar disc is initially a painless process because the disc has very few nerve endings. It is rarely the result of a single injury or incident. Once the degenerative process begins, it is easier to injure the disc doing activities that would not have injured a normal disc, such as bending and twisting, lifting, straining, or other normal activities of daily living. If you could see the disc, which you can't on an X-ray, it would look like this. It has an outer layer called the annulus, that is a ring-like structure that surrounds the nucleus. In a perfectly normal disc, it is difficult to injure the disc without injuring the vertebrae first, because the disc is very strong and mostly water. The intervertebral disc isn't visible on an ordinary X-ray. The X-ray only shows the space between the vertebrae where the disc sits. An MRI is needed to visualize the disc. MRI is an imaging method that looks at the water content of a structure. The intervertebral disc, which is mostly water, appears to have a bright center and darker edges on the MRI. The vertebrae are numbered according to the part of the spine: cervical, thoracic, lumbar, and sacral from top to bottom. The last lumbar vertebra is called L5, and the first sacral is called S1. The process of disc degeneration begins with the loss of water from the disc. The nucleus becomes less spongy, and the annulus weakens. If the annulus dries up more rapidly than the nucleus will push the weakened annulus at its narrowest point toward the back, which can cause the disc to bulge, much like an underinflated radial tire. Disc bulge is a common and normal finding in MRI and is usually not painful, or may cause temporary pain that goes away on its own. Abnormalities, including disc herniation, appear on the MRI of patients with no back or leg pain in about 35% of those ages 20 to 40, and even more frequently in older patients. As the disc loses water, it dries out or desiccates like a piece of natural rubber. It loses its elasticity, strength, and sponginess. The annulus develops cracks and fissures. This is usually not painful, or may cause short episodes or twinges of pain that resolve on their own, because there are very few nerve endings in the intervertebral disc. As the disc loses water or desiccates, it appears dark on an MRI. This process is usually painless, and the height of the disc remains normal. As the disc desiccates, it develops cracks and tears, which often take the form of a radial annular tear that appears as a white dot on an MRI. The process can become painful when the cracks or fissures reach the outer portion of the annulus. The outer annulus has nerve endings that stem from the spinal nerves. This pain can be felt in the leg as what is called referred pain. It is similar to a patient with a heart attack who is experiencing pain in the left arm. There is no compression of the nerves to the arm, just pain referred over these nerve pathways from the heart. If the annulus has fissures or tears in it, and the nucleus is under pressure or is pressurized as a result of movement such as bending or twisting, the nucleus can be forced into the cracks and tears in the annulus, which can result in a disc protrusion. Most protrusions are asymptomatic and do not progress to extrusion. Most resolve on their own. Disc herniation can occur in stages, with a disc protrusion leading to extrusion of the nucleus through the annulus. When the nucleus goes completely through the annulus, a disc herniation occurs. In rare occasions, the extruded portion of the nucleus detaches and becomes a free fragment within the spinal canal. This condition is called a sequestered disc. This is the appearance of an MRI of a lumbar disc herniation, seen in the axial or cross-cut view. If the herniated disc makes contact with the nerve root, it can cause leg pain, numbness, and weakness, commonly called sciatica. This MRI shows two views, axial and lateral, of a herniated disc that makes contact with the nerve root. The herniation is circled in orange. It is possible for a herniated nucleus to shrink as it dries up, so that symptoms such as pain, weakness, and numbness resolve as the disc shrinks. A common occurrence, it generally occurs within 6 to 12 weeks of the initial herniation. As it occurs, the leg symptoms will improve. The back pain may persist because the annulus remains abnormal, since the cracks and fissures remain. There are multiple treatment options for herniated discs. These options include non-surgical treatment, such as physical therapy and exercise, non-surgical invasive treatment, such as injections, and surgical procedures such as laminectomy, microdiscectomy, or minimally invasive discectomy. Your doctor will discuss treatment options with you and help you make the right decision.